Chip Means. We're down here with healthcare finance news and healthcare IT news in Portland, Maine, where President Obama is going to be speaking about healthcare reform legislation. And we're going to talk to some of the people outside of the event. There's a lot of people here to protest, a lot of people here in support, and people from all kinds of different parts of the healthcare industry who we're going to try to get comments from. So do you have health insurance?
I do currently. But it's been, I was without it for a while after college. I was on my parents' plan until I couldn't be any longer, and then I worked part-time, a couple of jobs for about a year or two. My girlfriend, she was working, and she just got healthcare for the first time since we graduated from college. She'd had to work part-time just to get 40 hours a week. So she struggled. She was working 3 or 4 jobs times, and there was always a factor in if you slip and fall or hurt your knee or tweak something, is it worth it to go get it looked at? Because sometimes you're just afraid of what you're going to find out. Because even if you find out something serious, you don't have the money to pay for it.
And what are you hoping, from your perspective in the healthcare industry, what are you hoping this legislation will do for?
Well, I'm hoping it will free up the emergency rooms so that people can partake in preventative medicine rather than... We, as a whole, are spending our money for people that don't have health insurance, right? So if everybody has health insurance and everybody's covered, then it's going to be great for everybody.
Is there any certain message that you're here to either support or to hear from our president?
I think I just want to clear up misconceptions that that people have about what the healthcare bill is about, really.
Are you aware of when patients don't have eligibility status?
A lot of times, no, we're not. We give the same care to everybody.
Yeah, and so you're here today to see the president talk about healthcare.
Yeah, I basically want to see the president. I think he's really fascinating, and I think that he's done more in the last year with healthcare than we've managed to do in for a long time. So it's a beginning.
Well, this reform legislation is only going to help a few people, and what it may hurt more than anything is increase the cost of healthcare this year over last year. Last year it was $2.5 trillion. This year it's expected to go up $225 billion. And with the passage of the bill, it may go up more or less. But it's the cost that's a real problem. Because if you don't have a job, how are you going to pay for health care that costs you $13,000 when you go into an emergency room and get an aspirin?